Hello, I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Let's meet one. Well, Howard, thanks for joining me on Here for Good, the Inside Edition.
My pleasure.
You've been here for quite some time. Matter of fact, I'm told you were born at
West Jersey Hospital in Camden.
Really?
Where my father was on staff as an obstetrician. He did not deliver me.
He did.
No, but I think he was in the building. He was always in the building.
He was always. So I assume with him being a physician, did that have anything to do with your decision to go down the same path?
Absolutely, of course. When you grow up in a medical household and your father's office is in the house, as ours was in Fairview, and he brings you to the hospital.
You spent time with him at the hospital?
He'd go in at night when a woman was in labor, and he'd bring me with sometimes, and there was a bunk bed in the doctor's on-call room, and I would sleep there. And in the morning, the nurses would give me milk and cookies. So,
Really?
You know, when you grow up with that, you go, life is good, right?
Well, milk and cookies for breakfast,
Yeah,
I'm sure
not
was
bad.
Not a bad thing.
Not bad.
What about surgery spoke to you and still speaks to you now?
Yeah. I actually thought I was going to do obstetrics, and one rotation through that convinced me this is not for me. I want to do something different.
Really?
Yeah. But when you start in medical school, you don't know what you're going to do. You have no idea. But in the first week or so, I kind of wandered into the emergency room, and this was in New York City in a city hospital. And it was kind of divided between the medical side and the surgical side. And it looked like all the action was on the surgical side. And I said, I'm going there. It's the gratification of seeing your results immediately, taking people who are unhappy and making them happier.
You've accomplished a lot in your career. Can you give me sort of the Cliff Notes version of some of the things that you've done?
I came here in 1978. Fresh from my residency, I joined and established a surgical practice. There were no surgeons working for the hospital at the time. Everyone was in private practice. And I stayed with that group, same group, through until about 10 years ago, when John Matzinger and a couple other guys sort of pulled me in and said, you know, you've been the chairman of the department for a while. Are you interested in doing some administrative work, some quality work? And I said, sure. I think that would be great.
Your role as vice president of surgical practice and outcome, what's the scope of what you do within that particular or your current role?
Yeah. So it's twofold. Surgical practice means how we operate. And I don't mean the technical aspects of it. I mean, Virtua has 5 hospitals. If you go to one hospital and then to another, the experience in surgery ought to be pretty much the same. Right? We don't want to have certain standards here and not have the same standards over here. And so that's what it's meant by surgical practice. And then outcomes, we want to talk about the quality of the work that we do. That's an elusive word, quality. You know, it means different things to different people.
And it's a journey.
It's a journey. It's a journey.
I know that you're leading a team right now that's reviewing our patient consent form.
Yeah.
Right. Why is and trying to make them easier to read and understand? Why is that important?
You know, it came as a shock to me when I found out that about a third of the population in the United States reads at a 6th grade reading level, and so to have a form that's full of medical ease is crazy. It's worthless. People look at it, they sign it, they don't know what they're signing, they have no idea what it's all about. And so the form itself has to be changed to be simpler. They have to understand what's going on, what kind of procedures we're doing, why we're doing them, what are the alternatives, what are the risks, and in a way that they can understand and then trust the person who's doing the procedure.
When you look back at your entire career, what changes or innovations would you consider the most noteworthy? When you think about all of the things that you've seen in multiple decades, is there anything that just jumps out at you?
One you might not think about, and that's anesthesia. When I was doing my training and in the first few years, everyone was asleep under general anesthesia. Along comes what we call conscious sedation, where people get medications through the vein, and they're no longer put deep under anesthetic when it's not necessary. That's made it possible to do a lot of surgery without the risks of general anesthesia. The second thing is outpatient surgery. Everybody used to stay in hospital 3, 4, 5 days for a hernia operation. Today, people go home the same day. And I guess the last, and this is, I'm really proud of what Virtua has done, is in the field of robotics, because this has revolutionized what surgeons can do. It's put them almost inside the belly in this environment, looking around. Great instrumentation, great visualization, and much safer surgery.
All of us look for things that keep us connected as individuals, that provides us with an outlet, that helps us deal with the stresses of being a physician. In your case, I know that you and your wife, I won't call it a hobby, have a passion for singing.
True.
And you both sing in a choir.
Yeah.
Tell me about that. I've known you all these years,
Yeah.
and I find out things about you every day.
Yeah. For the last 20 years, I don't strike people as a singer. The nice thing about singing in a choir is that you're not a soloist, at least not on purpose. If you have a voice that can blend with others, it's great. So my wife and I sing in a choir in Philadelphia. We sing Jewish music of all types, religious, secular, in 6 or 7 different languages. Last year, we were invited to sing in Berlin, Germany at a festival, and we're going to Paris this summer.
Do you have a preference of genre, of type of music that you enjoy most?
So the music that I enjoy most is medieval music. If you heard it, you would think it's Gregorian chant. You would associate it with church music.
Okay.
That's what it would sound like to you, but it's in Hebrew. And it was composed 1300, 1400s in Italy.
When did you recognize that you had, one, talent, but then the love of this particular music?
I think as a teenager, I went to a summer camp. I was a counselor there. I took care of kids there, and music was a very big part of it. I played a trumpet in the high school band, but that's not it. There's something about music and harmony that someone once taught me, that choral music is the paradigm for world peace. It's many voices coming together, different voices, in a melodic way, in harmony.
Have you ever sang for any of your patients?
I've never, that I would not do. I've sung in the operating room, but they've been asleep.
But they've been asleep. Well, I think I'm going to throw out a new challenge for you. Well, Howard, clearly you are a man of many talents, and I think Virtua is fortunate to have you as one of our leaders, one of our clinicians, and I can't thank you enough for joining me on Here for Good.
Thanks. What I wanted to just say to you, that I think Virtua is a very special place. It's a place where many different kinds of people come together to take care of patients. I would say it's a unique place. I haven't seen so much of that around, and there's a reason why I've been here all this time.
We are truly a sum of our many parts, and which I think is what makes us so special, and you, without doubt, are one of those. So a great conversation with one of our talented physicians and physician leaders. And we look forward to you tuning in for the next edition of Here for Good.